If you live with type 2 diabetes, have you been told that you should stop drinking milk completely? Or have you heard that one special milk can reverse type 2 diabetes and lower blood sugar overnight? Here is the truth that many people never hear clearly. No milk can cure or reverse type 2 diabetes. But the wrong milk may raise blood sugar, while the right milk, used in the right amount and at the right time, may support better blood sugar control. I'm Dr. Nathon Fox, and today I want to explain the best milk for diabetes. After 60, doctor explains how to support lower blood sugar. After 60, your body may handle sugar differently. Your muscles may become weaker, your insulin response may become slower, and the milk you use in coffee, cereal, breakfast, smoothies, or tea may quietly affect your blood sugar every day. In this video, I'll explain 5 milk choices for people with type 2 diabetes. You'll learn why lactose-free or high-protein milk may offer more protein with less sugar in some products, why plain kefir may support gut health, why unsweetened almond milk may be a low-sugar choice, and why unsweetened soy milk may support protein intake and heart health. But stay with me, because the most useful choice is not only which milk you drink, it is also how and when you drink it. Researchers call this the protein preload, and I'll explain why this method may help some people reduce the blood sugar spike after a meal. Before we begin, write your age in the comments. Also tell me which milk you currently drink: cow's milk, lactose-free milk, high-protein milk, kefir, unsweetened almond milk, unsweetened soy milk, oat milk, coconut milk, or no milk at all. Many people with type 2 diabetes are confused about milk because milk does not always taste sweet. They assume that if something does not taste sweet, it cannot affect blood sugar. But regular milk contains a natural sugar called lactose, and lactose is a carbohydrate. Carbohydrates can raise blood sugar. That does not mean every person with type 2 diabetes must avoid milk. It means milk must be counted as part of the meal, just like bread, cereal, fruit, rice, potatoes, and other carbohydrate foods. The label matters because 2 milk cartons that look almost identical may contain very different amounts of total carbohydrate, added sugar, protein, calories, and saturated fat. A plain unsweetened milk may fit your plan, while a chocolate, vanilla, honey, or sweetened milk may cause a much larger blood sugar rise. The amount matters too. A small amount of milk in coffee is different from a large glass. 1 cup is different from 3 cups. A small serving with a balanced meal is different from drinking a large sweetened milk drink by itself. After 60, the right question is not simply, is milk good or bad? The right question is, which milk, how much milk, and how does my blood sugar respond to it? That brings us to number 5 on the list: lactose-free milk or high-protein milk. Many people hear the words lactose-free and assume that lactose-free milk contains no sugar. That is not always true. Lactose-free milk usually still contains the natural milk sugar, but an enzyme has already broken that sugar into smaller parts. This may make the milk easier to digest for someone with lactose intolerance, but it does not automatically make the milk carbohydrate-free. That is why you must read the nutrition facts label. Look at total carbohydrate, total sugar, added sugar, protein, serving size, calories, and saturated fat. Do not make your decision from the words printed in large letters on the front of the carton. A lactose-free milk may be helpful if regular milk causes bloating, gas, cramping, or diarrhea. But if blood sugar control is your main concern, compare the total carbohydrate with other choices. Some lactose-free milks may contain nearly the same total carbohydrate as regular milk. Now let's talk about high-protein milk. Some ultra-filtered dairy milks remove part of the natural sugar while concentrating the protein. This can produce a milk with more protein and fewer carbohydrates than regular milk. Protein may slow digestion and may reduce how quickly a meal affects blood sugar. Protein is also important after 60 because many seniors gradually lose muscle. Protecting muscle matters for balance, walking, strength, metabolism, independence, and healthy aging. But high-protein milk is not automatically the best choice for every person. Some products contain added sugar, flavoring, sweeteners, or more saturated fat. You still have to check the label. A woman I'll call Margaret was 64. She enjoyed a large latte every morning and noticed that her blood sugar was often higher afterward. She thought coffee was causing the problem. But when she examined her routine, she discovered that her latte contained a large amount of regular milk and flavored syrup. Margaret changed to an unsweetened high-protein milk, removed the syrup, and used a smaller portion. She did not stop drinking coffee. She simply changed the milk, removed added sugar, and reduced the amount. Her blood sugar response became more manageable. The important lesson is not that high-protein milk cured her diabetes. The lesson is that a lower sugar portion fit her diabetes meal plan better than a large sweetened latte. If you choose lactose-free milk or high-protein milk, look for an unsweetened product with more protein and less total carbohydrate. Use the serving size printed on the label and check your blood sugar response if your diabetes care team has asked you to monitor after meals. The next choice is number 4, plain kefir. Kefir is a fermented dairy drink. Fermentation means bacteria and yeast have acted on some of the milk components. Plain kefir usually contains protein, calcium, and live cultures. Live cultures are often called probiotics. They may support the gut microbiome, but not every kefir contains the same cultures or the same amount. And the presence of probiotics does not mean the drink is automatically low in sugar. This is where many people make a mistake. They hear that kefir supports gut health, then choose a strawberry, vanilla, mango, honey, or fruit-flavored kefir. The product may contain enough added sugar to work against their blood sugar control. The word you should look for is unsweetened or plain. Then check total carbohydrate and added sugar on the label. Plain kefir still contains some natural milk carbohydrate, so it must still be counted in your meal. A man I'll call Robert was 69. Every morning, he drank a large glass of orange juice because he believed fruit juice was healthy. His blood sugar was often high after breakfast. Robert replaced the juice with a small serving of plain, unsweetened kefir alongside a balanced breakfast. The kefir contained protein and was not a fast, sugary drink like juice. He also reduced his breakfast cereal portion and added eggs. His morning blood sugar improved, but kefir was only one part of the change. The smaller carbohydrate portion, additional protein, and removal of juice all mattered. Some people tolerate kefir better than regular milk because fermentation may reduce part of the lactose. But others may still experience bloating, gas, or digestive discomfort. Start with a small amount if you have never used it before. Do not assume that probiotics can replace diabetes medication. Kefir may be one food inside a healthy diet, but it cannot cure type 2 diabetes, repair every gut problem, or guarantee lower blood sugar. If you have a weakened immune system, serious illness, or have been advised to avoid certain fermented products, speak with your doctor before using kefir regularly. Now let's move to number 3, unsweetened almond milk. For many people with type 2 diabetes, unsweetened almond milk may be one of the lowest carbohydrate choices in the milk aisle. Because it contains very little carbohydrate in many brands, it may have a smaller immediate effect on blood sugar than regular milk. But the most important word is unsweetened. Sweetened almond milk and flavored almond milk may contain added sugar. Vanilla does not automatically mean sugar-free. Chocolate almond milk may contain a large amount of added sugar. Even products that look healthy may contain cane sugar, syrup, or other sweeteners. Read the label and compare total carbohydrate and added sugar. Do not rely on the picture of almonds on the carton. Unsweetened almond milk may work well in coffee, tea, low-carbohydrate cereal, or a smoothie. It can be useful when someone wants a light milk with very little sugar. But unsweetened almond milk has an important weakness. It is usually very low in protein. After 60, protein is important for protecting muscle, supporting recovery, and maintaining strength. This means unsweetened almond milk may be a good low-sugar drink, but it should not be treated as a major protein source. You still need protein from eggs, fish, chicken, yogurt, beans, tofu, lentils, meat, or other foods that fit your diabetes plan. A woman I'll call Susan was 58. She drank 3 cups of coffee every day and added regular milk to each cup. The amount seemed small, but by the end of the day, the carbohydrate added up. Susan changed to unsweetened almond milk in her coffee. She kept the portion measured and stopped using sweetened creamer. This removed a quiet source of carbohydrate and added sugar from her routine. But Susan did not begin drinking large glasses of unsweetened almond milk for protein because it contained very little protein. Instead, she ate a protein-rich breakfast. This is the right way to understand unsweetened almond milk. It may be a low-sugar choice, but it is not a complete nutrition solution. Also check whether the product is fortified with calcium and vitamin D. If you are replacing dairy milk completely, fortified products may help provide nutrients that would otherwise be missing. If you have a tree nut allergy, unsweetened almond milk is not safe for you. Choose another milk after speaking with your doctor or dietitian. Now let's move to number 2, unsweetened soy milk. For many people with type 2 diabetes, unsweetened soy milk is one of the best balanced plant milk choices. It is generally low in added sugar when unsweetened, and it contains more protein than most almond, oat, rice, or coconut milk products. Soy protein is considered a complete protein because it provides all the essential amino acids. This makes unsweetened soy milk more useful for protecting muscle after 60 than a low-protein drink like almond milk. Protein may help create a more balanced meal. It may slow digestion, support fullness, and help reduce the speed at which carbohydrates affect blood sugar. But once again, the word unsweetened matters. Sweetened soy milk, vanilla soy milk, chocolate soy milk, and flavored soy drinks may contain added sugar. A man I'll call David was 66. He had type 2 diabetes and high cholesterol. He wanted to reduce his use of whole dairy milk, but he did not want a milk with almost no protein. David chose fortified, unsweetened soy milk. He used it in coffee, cereal, and cooking. The product provided protein without a large amount of added sugar. He also reduced processed food, took his medication as prescribed, walked after meals, and checked his blood sugar. Over time, his overall health plan improved. It would be wrong to say that unsweetened soy milk caused every improvement, but it was a practical milk choice that fit his plan. Some people worry that soy is dangerous for everyone. For most adults, normal food amounts of soy can fit a healthy diet, but individuals with a soy allergy must avoid it. People with thyroid disease may also need to discuss timing with their clinician, especially if they take thyroid medication. Do not stop medication or change the dose because of something you hear online. If you use unsweetened soy milk instead of dairy milk, choose a fortified product when possible. Look for calcium and vitamin D, and sometimes vitamin B12. Now we have reached number 1, and this is the most important part of the video. Number 1 is not a specific carton. It is the protein preload. A protein preload means having a small amount of protein shortly before or at the beginning of a meal containing carbohydrates. Researchers have studied whey protein before meals in people with type 2 diabetes. Protein reaching the digestive system before carbohydrates may slow stomach emptying and affect hormones involved in insulin release and appetite. In some studies, this reduced the blood sugar rise after the meal. This is why timing may matter. Imagine that you eat toast, cereal, oatmeal, fruit, rice, or potatoes. These foods contain carbohydrates. If you eat the carbohydrate alone, it may enter your system more quickly. But when protein is included before or with the carbohydrate, digestion may be slower, and the blood sugar curve may be gentler for some people. Milk contains protein, especially dairy milk with whey and casein. Unsweetened soy milk also provides protein. This means a small portion of unsweetened high-protein milk or unsweetened soy milk may be used as part of a protein preload strategy. A woman I'll call Eleanor was 72. Every morning, she ate toast and oatmeal. Her blood sugar rose sharply after breakfast. She did not want to give up those foods completely. Eleanor worked with her diabetes care team. She reduced the oatmeal portion, changed the bread, and included protein. She drank a small amount of unsweetened high-protein milk shortly before breakfast. Her blood sugar rise became smaller on some mornings, but the result was not because of milk alone. Her portion, total carbohydrate, protein, medication, activity, and meal timing all mattered. This is an important warning. A protein preload is not safe or necessary for everyone. If you take insulin or medication that can cause low blood sugar, changing your meal timing or carbohydrate intake may affect your blood sugar. Monitor carefully and speak with your diabetes care team before making a major change. If you have kidney disease, you may need to limit or manage protein, potassium, or phosphorus. Do not begin a high-protein routine without medical advice. If you have gastroparesis, a condition in which the stomach empties slowly, adding a preload may worsen fullness, nausea, or digestion. Speak with your doctor. If you are trying to lose weight, remember that milk still contains calories. A preload that is added on top of a large meal may increase total calories. The strategy should fit the full meal, not become an extra unlimited drink. Now let's explain how to test the protein preload safely. Choose a small amount of unsweetened high-protein milk or fortified unsweetened soy milk. Around half a cup may be enough for some people, but your personal amount should fit your diabetes meal plan. Drink it shortly before the carbohydrate part of the meal or have it at the beginning of the meal. You do not need a giant glass. Keep the rest of the meal balanced. Include non-starchy vegetables, a protein food, and a controlled carbohydrate portion. If you monitor blood sugar, compare similar meals on different days. Check at the time recommended by your diabetes care team. Do not draw a conclusion from one reading because stress, sleep, medication, illness, activity, and many other factors can change blood sugar. The goal is not to chase a perfect number after one meal. The goal is to identify a routine that supports steadier blood sugar control over time. Now, let's review the 5 milk choices. Number 5 is lactose-free milk or high-protein milk. Lactose-free milk may be easier to digest, but it does not always contain less total carbohydrate. High-protein milk may provide more protein and less sugar in some products, but you must read the label. Number 4 is plain kefir. Plain, unsweetened kefir provides protein and live cultures. But flavored kefir may contain a large amount of added sugar. Number 3 is unsweetened almond milk. It may be very low in carbohydrate, but it is also usually very low in protein. Number 2 is unsweetened soy milk. It provides more protein than most plant milks and may work well as a dairy replacement when fortified. Number 1 is the protein preload. A small amount of protein before or at the beginning of a carbohydrate meal may support a smaller post-meal blood sugar rise in some people. Now let's discuss the milk choices that may work against blood sugar control. The first is sweetened milk. Chocolate milk, flavored milk, sweetened plant milk, and milk drinks with syrup can contain a large amount of added sugar. The second is oat milk with added sugar. Oat milk is often presented as healthy, but oats are a carbohydrate. Some oat milk products contain more carbohydrate than unsweetened almond milk or unsweetened soy milk. Some also include added sugar. This does not mean every person with type 2 diabetes must avoid oat milk. It means the label and portion matter. The third is rice milk. Rice milk is generally higher in carbohydrate and lower in protein. It may cause a larger blood sugar rise for some people. The fourth is sweetened condensed milk. Sweetened condensed milk contains a large amount of sugar and is not the same as plain milk. A few large spoonfuls can add a significant sugar load to coffee or tea. The fifth is sweetened coffee creamer. Many creamers contain added sugar, syrup, and oil. The serving size may be only 1 tablespoon, but many people pour much more than 1 tablespoon. The sixth is large milk smoothies. A smoothie may contain milk, fruit juice, bananas, dates, honey, oats, sweetened yogurt, and protein powder. Each ingredient may look healthy, but the total carbohydrate can become extremely high. Now let's talk about reading the label. First, check the serving size. All the other numbers are based on that serving. Second, check total carbohydrate. This includes the carbohydrate that can affect blood sugar. Third, check added sugar. Try to choose milk without added sugar. Fourth, check protein. High-protein milk and unsweetened soy milk may provide more protein than unsweetened almond milk. Fifth, check saturated fat. People with type 2 diabetes have a higher risk of heart disease, so the full heart health pattern matters. Sixth, check sodium, potassium, and phosphorus if you have kidney disease or have been told to monitor these minerals. Seventh, examine the ingredient list. A shorter list may make it easier to understand what you are drinking. Now let's discuss blood sugar monitoring. Blood sugar responses are personal. One person may tolerate a small glass of regular milk, another may see a larger rise. One person may do well with unsweetened soy milk, another may have a soy allergy or digestive symptoms. Use your glucose meter or continuous glucose monitor if your diabetes care team has advised you to do so. Compare your reading before a meal and at the time recommended after the meal. Do not change medication based on one result. Do not stop insulin because one breakfast produced a lower reading. Discuss repeated patterns with your doctor. Also, watch for low blood sugar. Symptoms may include shaking, sweating, hunger, dizziness, confusion, weakness, or a fast heartbeat. If you use insulin or medication that can cause low blood sugar, always follow your treatment plan for hypoglycemia. Now let's build a simple 7-day milk plan. On day 1, check every milk product in your refrigerator. Look at total carbohydrate, added sugar, protein, and serving size. On day 2, replace sweetened milk with an unsweetened version. On day 3, compare regular milk with lactose-free milk and high-protein milk. Do not assume lactose-free means low sugar. On day 4, try a small serving of plain, unsweetened kefir with a meal if you tolerate dairy. On day 5, use unsweetened almond milk in coffee or tea, but remember that it is not a strong protein source. On day 6, try fortified unsweetened soy milk if you tolerate soy and want a higher protein plant milk. On day 7, discuss the protein preload with your doctor, diabetes educator, or registered dietitian, especially if you use insulin, have kidney disease, or experience low blood sugar. Here are the biggest mistakes people make. Mistake number 1 is choosing milk by the front label instead of the nutrition facts label. Mistake number 2 is assuming lactose-free milk contains no carbohydrate. Mistake number 3 is buying flavored kefir without checking added sugar. Mistake number 4 is thinking unsweetened almond milk provides the same protein as dairy or unsweetened soy milk. Mistake number 5 is adding honey, syrup, sugar, or sweetened creamer to a low-sugar milk. Mistake number 6 is drinking too large a portion. Mistake number 7 is believing that one milk can reverse type 2 diabetes. No milk can do that. Type 2. Diabetes management depends on the full plan: medication when prescribed, blood sugar monitoring, carbohydrate portions, physical activity, sleep, stress management, weight management when needed, blood pressure control, cholesterol control, and regular medical care. Milk is only one choice inside that plan, but small choices matter because they repeat every day. If you use milk in 3 cups of coffee, cereal, and a smoothie, the amount can add up. Changing to an unsweetened milk may remove a meaningful amount of added sugar from your routine. If you replace juice with plain kefir, that may create a more balanced breakfast. If you replace sweetened oat milk with unsweetened soy milk, you may add protein while reducing added sugar. If you use unsweetened almond milk in coffee, you may reduce carbohydrate, but you still need protein from food. If you use a protein preload, you may reduce the blood sugar rise from a carbohydrate meal, but only when the method fits your medication and medical needs. Now let's review the final answer. The best milk for type 2 diabetes is not the same for every person. For someone who wants dairy and more protein, unsweetened high-protein milk may be useful. For someone who wants fermented dairy, plain kefir may fit. For someone who wants the lowest possible carbohydrate in coffee, Unsweetened almond milk may be useful. For someone who wants a higher protein plant milk, unsweetened soy milk may be one of the best choices. For someone who wants to reduce the after-meal blood sugar rise, a medically appropriate protein preload may be worth discussing. The wrong choice is usually not milk itself. The wrong choice is a sweetened milk, a large portion, hidden added sugar, or a product that does not fit your health conditions. So do not fear the milk aisle. Read the label. Check total carbohydrate. Avoid added sugar. Look at protein. Control the portion. Monitor your blood sugar, and work with your diabetes care team. Write milk in the comments if you want a simple diabetes-friendly milk checklist. Also tell me which option you currently use: high-protein milk, kefir, unsweetened almond milk, or unsweetened soy milk. If you are over 50 or 60 and managing type 2 diabetes, prediabetes, insulin resistance, high blood sugar, diabetes nutrition, or blood sugar control, subscribe to Dr. Nathon Fox. On this channel, I explain senior health in simple language so you can make safer daily choices. This video is for educational and informational purposes only. It is not medical advice, diagnosis, or treatment. No milk can cure or reverse type 2 diabetes, and milk does not replace diabetes medication, insulin, blood sugar monitoring, medical care, or an individualized eating plan. Always speak with your doctor, diabetes specialist, pharmacist, or registered dietitian before changing your diet, meal timing, protein intake, medication, or insulin. This is especially important if you have kidney disease, heart disease, lactose intolerance, milk allergy, soy allergy, gastroparesis, frequent low blood sugar, or take medication that can cause hypoglycemia. Seek urgent medical care if you experience severe low blood sugar, fainting, confusion, trouble speaking, chest pain, difficulty breathing, severe weakness, or blood sugar that remains dangerously high or low according to your medical plan. After 60, you do not need a miracle milk. You need the right milk, the right portion, the right timing, and the right diabetes plan. One carton will not cure type 2 diabetes, but one honest, practical choice repeated every day may help you support steadier blood sugar. I'm Dr. Nathon Fox. Read the label. Avoid added sugar. Protect your muscles. Watch your blood sugar. Take your medication as prescribed. And before you pour your next glass, ask one question. Does this milk support my blood sugar control, or is it quietly adding more sugar than I realize? I'll see you in the next video.